Welcome to the Hack My Age podcast. Another episode is in your box. So get ready for this amazing talk that we're going to have with Dr. Jill Chmielewski. I love saying her name. Some people call her Jill Chmielewski. um, and you don't have to know how to spell it or say it. I just like saying it. Before I introduce her and how I met her, I want to just remind you that if you're on the fence about the Biohacking Menopause membership group, please join in. It's only $24.99. This is nothing. The price is going to increase at some point, and I want you to get in because this is such a wonderful group of women that we're getting in. Every month we get more and more, and we get such supportive people helping you navigate your way through menopause. And you learn biohacks. You learn so much about red light therapy and cold plunging and hormone therapy, things that perhaps you've never even heard of before. And I want to help you have the smoothest transition ever. And it's not just me, it's our supportive community. So jump on in. If you come in before May 1st, 2024, you get to participate in the new Cheeto giveaway. New Cheeto, if you heard the last podcast, is an amazing supplement that is supporting your NAD levels. NAD is for energy production, not only how you feel. So if you're feeling fatigued, this is a really great way to jumpstart your energy and get to the gym and do other work to support the NAD. But it's also supporting the energy in the cells so all the organs can function even better. You'll learn a lot more about that in the podcast. I've done several podcasts with her, but jump in. You have a chance to win new Cheeto. Every month we have giveaways. We have somebody giving something to you guys. So please jump in, enjoy the network, and I have the link to the group in the show notes. So let's get back to Jill. I met her originally through Dr. David Rosensweet. This is the doctor who's created this menopause method program that I trained in. It's through the Institute of Bioidentical Medicine. She was the female voice, balancing things out in our episode together with Dr. Rosensweet just not that long ago. And we were discussing the confusion that we all have with hormone therapy. And she also went through the Menopause Method program and is a board member at the Institute of Bioidentical Medicine. And Jill, she's a registered nurse. She's a certified health coach, and she is, like me, an advocate for aging women. And she's on a mission to change the way we approach menopause and aging. You see why I like her so much, right? And she really helps midlife women break free from the mainstream way of thinking where disease and decline are accepted as an inevitable part of aging, and then instead to embrace the notion that it's totally possible to feel vibrant, happy, healthy, and balanced, and sexy and strong in midlife and beyond. Really, we hit it off in our first episode with Dr. Rosensweet, and in this one, she really shines, and the focus is on her own expertise, and we covered some very real struggles that we all have in the menopause space when we're trying to figure out what's true and what's relative to our own needs and what's not. And in this episode, you're really going to like it because she empowers us with some great perspective on what to do when we get totally confused and just overwhelmed by conflicting advice that we may see on social media. And we also cover the controversial article by The Lancet. You've heard me in a couple episodes before talk about that. She talks about her favorite delivery methods for hormone therapy and what women who choose not to use hormone therapy can do to protect their brain, heart, bones, and sexual function. And Jill has her own website, jillchmielewski.com, and all the social media channels are also under her name. And she's got community, she's got guides for a woman trying to navigate this wild ride through perimenopause and menopause. And to make things easy for you, just go to the show notes and I will have all the links to her accounts. Okay, so let's once again meet Jill Chmielewski. I know some people call you Chmielewski, but let's they both go.
I like your
Welcome.
version of it better. I think that's actually the proper way to say it. Maybe you can teach me how to say it the proper way. Yeah.
Chmielewski, it all goes. So welcome.
Yes. Thank you. Thanks for having me. I'm thrilled to be back. Thrilled.
So I have these list of questions that I have to sort of guide me through, but I think I want to start with because we were talking off off camera and it was so juicy. I said, let's stop talking because we have to record this and because it's such good conversation. So I think we're going to start with that question. I mean, I'm going to make up a question right now because what we were talking about was the confusion that women have during this perimenopause phase and they're trying to figure out what's going on. And especially if you're taking hormone therapy, you hear so much. I mean, we've covered in the podcast with so many of our guests, like there's sprays and creams and gels and pellets and oral. It's just all over the place. So it's a really confusing place when you first step into this space. And in fact, I just had a call yesterday with one of our new members of the Biohacking Menopause membership group, and she just got her formula and she's like desperate. I don't know. Do I take this in the morning and do I take it in the evening and how much and what does that mean and what? It's like,
Yeah.
it just calm down. It's okay. But I was exactly the same when that happened to
Mhm.
me. It's a confusing world. And so some of us are unbiased, which is, a combination of estradiol and estriol. Some of us are just taking progesterone only. And then you hear stuff on social media that something is really bad and you shouldn't be
Yeah.
taking it.
Yeah.
And then you get scared because your doctor recommended this and your doctor knows you better than anyone else. I guess that person has your whole history, but these are bring up questions that I think people should bring to their doctors. But Jill, let's kind of continue this conversation that we had about the confusion that a woman faces and what are the things that she sees, and then let's help her figure some of this out to calm down and relax and just go, okay, let's figure out my own formula. What do you think?
Yeah, I mean, so we were talking because there's been a lot, again, a lot of times, a lot of what we talk about comes from, well, lots of questions from women who see things on social media and then they're sort of bringing their questions to us or messaging us saying, hey, is this true? Is this true? Is this true? And so one of the questions, there was a post yesterday on social media about biased, which is a combination of estriol and estradiol, two types of estrogen. Both are made in the body. And it's an option. That's one option for estrogen hormone replacement therapy. That's a combination of two estrogens, or a lot of providers will prescribe just estradiol, one of the estrogens made in our body. There's different schools of thought. There's different camps on why one provider would choose one over the other. But what I've been seeing and what people were sending me was, hey, providers are saying that, estriol, which is one of the estrogens that's in biased, is, I've heard the term watered down estradiol. It is less effective. It is weaker. It is weaker. We know that it's like 1/8 as potent as estradiol, but it does play a role in the body. And I think that's where we're always trying to take women back to, that any estrogen is better than no estrogen, truly. I mean, any estrogen, the estrogen replacement that we use in women is not going to be, it's micro doses compared to what a woman has in her 20s or when she's getting a period. So, for frame of reference, these are teeny, 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 tiny amounts compared to what our bodies were making before. And our bodies did just fine with those levels before and thrived with them. So we're talking about these microscopic levels really of hormones that we're trying to bring on board for symptom relief and to protect the body systemically, which we can talk about, I know, later. But this idea that biased is bad, or that it is, unsafe, or that it is not as effective. I think how we look at it is there's this buffet of options for women, and we don't want to really ever exclude any option. The reason that I think you and I have, and I mean, I tend to lean towards bias, and I can share why I do. And it's simply because, and this is again, my training and where I've come through training, and you have too with Dr. Rosensweet and other providers as well, but that we do make estriol in the body. We make estrone, estradiol, estriol. We make loads of estriol when we're pregnant. I always thought we only made estriol when we were pregnant, and learned from Dr. Rosensweet that we actually make a lot of estriol, more estriol than the sum of estrone and estradiol combined, even when we're not pregnant. that can only be discovered through 24-hour urine hormone testing because it's that metabolic end product of estrogen breakdown. But when you look at the body and you go, well, this is how the body functions, there's this massive amount of estriol. And so for listeners that don't understand, estrogen is a little more complicated. It signals receptors in the body just like all hormones. But the kind of key thing with estrogen in particular is, we've just really started to discover, I think in the 90s, these estrogen receptors were discovered. And I'm sure we're going to discover more estrogen receptors. But right now, what we really know a fair amount about is estrogen receptor alpha and estrogen receptor beta. And alpha is that sort of stimulatory growth, proliferation. I think about it as, I think Lindsay Berkson calls it, it's like the big boss, like the head honcho. And then estrogen receptor beta is the yoga, the calming, the controlled signals, controlled growth. And we want this balance in the body. And we know that the body works best when both of those estrogen alpha and estrogen receptor beta are signaled. We know that estradiol is the primary signaler of estrogen receptor alpha. We know that estriol is the primary signaler of estrogen receptor beta. So the idea is if someone is getting biased, they get a combination of two estrogens, which is going to help promote, I guess, better, more balanced signals, estrogen signals in the body. I mean, that's kind of the short piece of the story, but I think I think what's out on social media and the questions I'm getting for women are like, I'm on the wrong estrogen. I was told that that's bad, or that biased isn't as good as estradiol. Both are great options. It's really a matter of choosing what feels best for you, what resonates with you, which your provider prescribes. You're not going to go wrong with either one. It's just a matter of, once you get into the weeds of understanding estrogen receptors, doing 24-hour testing, things like that. And I'm talking about 24-hour urine, not dried urine, but true 24-hour collection where we see the levels in the body over 24 hours. You get some more clarity and you see that you can tweak things, these formulations. A lot of women don't necessarily make that much estriol, even if you give them estradiol. So it's really because in midlife, our bodies are changing, things are different. And so this is not to scare women off of one or the other, but to say there's options. Each woman is different. And so there may be one option may be better for you than another, but neither is the wrong option. I guess that's where we're going with it.
Exactly my thoughts. And
Yeah. Long
I
rant, long rant.
I
Sorry
know,
about that.
I know
Yeah.
it's true. We get so confused and wrapped up. And I think personally, I'm in social media and I understand we're trying to gain followers and trying our best to bring whatever it is, program or podcast, whatever, to the community. And I think some influencers look for clickbait. They look for controversial topics. They will make things, they will scare you. Whatever it is that's going to scare you. And I think it's, yeah, wrong. Um, it's okay to make somebody question it, but sometimes some of these menopause people, it's influencers, I guess, are sticking their flag into the ground and it's my way or the highway. And I don't think it's like that. I mean, I'm come from the biohacking world where we know we're all bio-individual. We all respond differently to things. And this is what I'm trying to do is teach women how to be their own scientist in their laboratory they called their body. And we know through our training and through so much experience that every woman is responding differently to
Yeah.
menopause and to the hormone therapy, right? You can't just give one formula, one size fits all. And you can't say menopause women are going to go through the same thing through menopause. And unfortunately, yeah, what this is when we're scrolling, we see the social media, this is what happens, and then we get scared. So I really want to empower women and just say, okay, it's information. You take it to your doctor, you question it. It may apply to you, maybe not, but your doctor should know your history, your health concerns. We don't know. The influencer who's sharing stuff, including me, like this is good, this is maybe not so good. It doesn't matter. You have to take
Yeah.
this to yourself. This is why it's important to get a good doctor who knows what they're doing. And unfortunately, this is another problem that we have in the world today, and hopefully that will change, is that doctors are just not trained. And in menopause, there are many doctors who are, but most are not, and they're not ready. And sometimes they just kind of throw things, and let's just see what happens. And that can make a woman nervous. And I think what you also said about testing is also important, because women also hear we should do only 24-hour urine tests. Oh, we should only do Dutch tests. Oh, we shouldn't do any of those tests at all. And my advice to women is to say, there are different methods for different doctors. And usually I find that doctors are comfortable doing whatever it is. They've gone through, probably, hopefully, if it's a good doctor, they've been doing this for years, if not decades. They are comfortable with whatever that test is. And they've probably seen a lot of women go through, and then maybe in their own head, they've got these sort of goalposts, or like where they think women are thriving. And if
Mhm.
you have a doubt, you question them, right? If you
Mm.
hear from me or Jill, like the 24-hour urine test is amazing and we love it, it's great. Ask the doctor, would you do that? Is that interesting? And they hopefully will give you a good explanation why they do it or
Mhm.
they don't do it. And I really believe in shared decision making and empowering the client or the patient. And I really want more doctors to be on board with that. And I really like Dr. Rosensweet's training with the Institute of
Oh,
Bioidentical Medicine. This is the menopause method. He's training all these doctors. And you and I went through this program, and it's made for doctors to, who are prescribing. I'm not prescribing, but I got a great view of what's happening behind the scenes. And I just think he's doing such a good job. And we just need more doctors trained this way, because I think
yes.
he's about empowering the patient.
So much so. And I think he has so much experience when a lot of the medical providers sort of left the menopause space in 2002 because of the WHI, he stayed on. So he's been treating women for now, he's been a doc for 50 years, he's been treating menopausal women very exclusively for the last 30 years. I mean, 30 years of partnership with patients. And, he is, there's nothing he hasn't seen with a patient. And he is himself. What I love about him is that he even recognized early on in his practice what was good medicine and what wasn't. And he's had this open mind always of being open to learning new things and seeing what works
Yeah.
best and trying to continue to always basically do right by the patient, whatever that is. And so that's really kind of a rare gem, of a man and of a doctor to be so just open and listening to patients and wanting to just keep doing better. It's just he's very inspiring. I think most of the people that go through his program are just really touched by his he's in medicine for the reason that I think a lot of people, are in medicine. It's really inspiring.
Yeah. If anybody wants a doctor trained by Dr. David Rosensweet, I have a link in the show notes for how to reach out to IOBIM and how to find a doctor trained by him, but and many other ways to find doctors too. But go take a look at that. Well, let's
Yeah.
move on. Let's move on to some of my
Okay.
questions. So I was
Yeah.
curious to know, and if you don't know, it's okay. Did you read the latest Lancet article that came out March 5th? This is 2024 for time. It's called Time for a Balanced Conversation About Menopause. Did you
I
read that?
did read it.
Hear
Yeah,
about
I
it?
did read it. Uh-huh. I think my sentiments were shared by many other, I think women, I think providers in this space that it nothing surprises me anymore, especially with a lot of these journal articles. I mean, I think you and I really kind of grew up in conventional medicine at the same time. And I was trained in conventional medicine, and I had such trust in my 20s in all of the big journals that were out there. And I think over time, you learn a lot about how the system works. And so I sort of take journal articles now with a grain of salt because I know what's behind them. Oftentimes, there's just things that a lot of people aren't aware of. And I think that article for me was like, it was setting us back once again. It's really this idea that we are, to say that women should just sort of like not, we're still pushing back on hormonal treatment for menopause, which is all these symptoms, both acute and of course a lot of those long-term changes are driven by hormonal changes. Why are we not shouting from the rooftops, hey, we've got hormone replacement therapy as a great option that's both safe and effective? And instead it's once again like kind of get over it, and we're over medicalizing yet these women end up getting sent to all of these providers for all of these issues that pop up because of hormonal decline, and then are prescribed a slew of medications. So, I just, on one hand, it upset me. And on the other hand, I thought, you know what? It's par for the course. This is what we've been pushing back against for so long. Women trying to be heard and seen, and women's experiences being acknowledged and validated. And so I just, yeah, it's irritating, honestly, more than anything. But I feel like we know our bodies. We know, those of us that understand what's going on, we just realized how far off base this article really was. That's how I feel. That was really my personal sort of
Yeah,
perspective on it.
it surprised me, took me back. I thought, wow, we're kind of stepping backwards again. But I guess it's menopause is very political. I mean, I didn't
It
realize
is.
this when I started in this space. I was like, why can't we all just get along and agree on things? But it was this article, in case people don't know what we're talking about. I did a great podcast with Dr. Heather Hirsch. Do you know her? And
I do. Yeah.
she had a huge rant on it, and I knew she had opinion about this. And the way she described, which is great. For those who don't know what the Lancet is, it's a scientific publication. It's actually quite well known in the UK. And she described it as an opinion article disguised as science, or a
hmm
scientific article. And that's exactly what it was. It was just someone's opinion. And because you're on a scientific journal, it's, has this recognition, and people will take it seriously. But it did feel like it was just, okay, ladies, just pick up your socks and get on with it. It's a natural process. Like,
Yeah.
really, let's stop talking about this and move on. It's been around for centuries, and it's just, so that kind of irked me. And there was I don't know who did this, but it was floating around. Maybe you saw it. And somebody had taken the same article,
hmm
and instead of the word menopause, they replaced it with erectile dysfunction.
I saw that. Yes.
And it was like, okay, guys, just go take a walk outside, like, get on with your lives. You don't need any
Yes.
medicine for that. Who needs sex? Like, just, get older and just don't need that. That would never be accepted. It was
No.
just,
No.
so why are we accepting this? And that was so brilliant how somebody did that. And it does make light to how women's health is really pushed under the rug for so long. And this is why we're trying to pick up the rug and say, "Look,
Yes.
we need help." And of course, there are women out there who have no symptoms. And that's, they're like, I'm sailing through this. And then when I do my interviews around the world, there's women who look at me like, why are you asking me this? It's just, I
Yeah.
don't know. It just kind of had a hot flash maybe. And then, whatever, they are the ones who are also saying, like, well, let's just move on. Well, because they're not suffering like the other person on the other side of the spectrum, right? We have a spectrum
Yes.
with this. So, you don't want to, I understand not, the pendulum can swing one way, and like, this is out of
hmm
control, but on the other way, we don't want it to swing the other way. I think it's just about a balance. But I do see that, yeah, women can also be on one side of this camp or the other because of their own experience. And and
Yes.
and I do worry about the women, just like Dr. David Rosensweet said, is the women who have no symptoms.
hmm
Because
hmm
just because you don't feel it doesn't mean you're not going through menopause. And there are
Yeah.
things, are like you said, the silent things that happen in under the hood that we don't know about. And because maybe you have symptoms, if you did, well, then you'll be more pressured, or gently nudged to start looking at your health and say, okay,
Yeah.
well, let me start sorting things out, because it's not just about replacing hormones too as we go through midlife. So
Yes.
yeah, that was,
I know
yeah.
it was a big one. I think people were talking about, pregnancy is also natural, but we do this whole, right? The support that women get during pregnancy is huge. It's a natural process that happens, but we still, right? You have 9 months of visits. You're going to your doctor every month. I mean, there's a whole series of things that we all know happens during pregnancy, and menopause is such a huge life altering transition that but to say that pregnancy should be medicalized and menopause shouldn't. I mean, it's just interesting how we view things. So yeah, it was a very, very interesting article. I just sort of am pushing it to the side for now,
Yeah.
just because it's really I don't think it gets us anywhere. It's causing it's stirring a lot of emotions. Although it's probably a good thing. It's inspiring people to really step up and even get a little bit louder, I think.
Yeah, yeah.
Yeah.
It's good. Okay, there's noise, whether it's, people can argue about it, but at least people are talking about it, and that's what the
Yeah.
first step, and the awareness and talking about it. Wouldn't it be great if one day when you're, say, you hit a certain age, I don't know, let's say 45, and then the medical systems kicks in and says, you know what, you need doctor visits, X amount of times to help you through this menopause journey. We're going to check up on you, and not only, are you feeling fine? Yes, I'm fine. No hot flash, and I'm feeling, and send you home. No, let's just take a little deeper dive. I mean, that would be such a dream. In
Oh.
in Spain, actually, I got a call from the local the medical system saying, "You're 50 now." Was it fit? No, this was recent. Actually, it was last year. I was 52. I think when you hit 50 or 52,
Mhm.
they they call you. No, I was 53, but anyways, they call you and they said, "Hey, you've hit this, age, and now you need to come in for a mammogram, free." I mean, this is, the socialized medicine. And I was like,
Yeah.
wow, like, that's amazing. Do you do that for bone
They've
density scans? Because I go for one of those too. Like, it should be,
Yes.
it'd be really nice if there was a call and say, "Hey, let's take a
Yes.
look at these things." And perimenopause would be just the perfect time
Oh,
to kick it in.
yes. Some hand holding would be really, really helpful during that time. Yeah.
Yeah. Yeah, and for
Yeah.
those who need it, some people are like,
Mhm.
"Fine, I don't need it," and then some will just, they book me in, I'm in.
Yeah.
So, let's move on. Gosh, I don't even remember what time we started. Oh, wait, I gotta plug in, hold on.
Okay.
My battery's going out. So
Oh, is it?
I
Okay.
I don't remember what time we started, but I want to make sure we have enough time. So,
Yes.
in our last episode that we did with Dr.
Mhm.
Rosensweet, you talked about the silent physiological changes that happen as a result of the decline in our hormones. And we also talked about the fear of HRT that's out there, and we busted some myths. Remind us about these silent changes that happen, and do you think that women should be changing the conversation about HRT by asking their doctor, what are the risks of not replenishing our hormones?
That's a great question, and that's something that I feel like in a lot of the speaking that I'm doing is that's where I'm going with it is, there truly is or seems to be more risk in not optimizing our hormones than in, using HRT. So the silent things that we talked about are, I mean, I think last time we talked about hormones and the way they signal, I mean, every single cell of our body has receptors for hormones, which tells us, so it's not just in our reproductive organs, which is what I think women are thinking of with hormones. So if every single cell of our body, which is like cells that make up, tissues and tissues make up organs, that means every organ of our body has these signals, these receptors for hormone signals. So what happens when those signals are no longer, happening? Well, we have changes in every cell, tissue, organ of our body, from our brain to our bones to our blood vessels and, everything else in between. So the silent things that are happening are those like more bone loss, more accelerated bone loss, muscle loss. We know that we have more muscle loss once we reach 30, but things really accelerate when we lose our hormones, when they start to decline. We have skin changes, we have connective tissue changes. So the entire musculoskeletal system is impacted. The blood vessels become stiffer, stickier, less flexible, more rigid. So we're at a higher risk for cardiovascular disease. We have genital urinary system changes. Sometimes, women will feel them. So I think from a silent perspective, blood vessel changes you probably aren't feeling, right? You don't feel, a lot of women will go in and go, I didn't even know I had high blood pressure, or they do a calcium test or whatever they're doing, or, they're doing their lipid levels. So you don't feel those or blood sugar changes necessarily, but they're happening. I think the genitourinary symptoms also in some ways are silent until they're not. So they're kind of silent for a while. And then all of a sudden you're like, geez, I really things don't feel right down there. Or maybe you're not connecting it to the hormones, but it's frequently getting up at night to go to the bathroom, more frequent urinary tract infections, things like that. So just thinking broadly about all of these things that are happening in the body. And when you think about, I think the two big ones for me, and brain changes too, there are brain changes. We know that there are changes in memory, mood, temperature, many, many, many things in the brain. So, just kind of this big slew of things to think about. And I feel like it's those silent ones that are the ones that really worry me, because they're happening without our knowledge. And then we wake up one day. So women will say, I fell, I broke a bone, I end up doing a DEXA scan. I realize I've got really significant osteoporosis. Had no idea. And I think when we look at the things that kill women, it's cardiovascular disease, it's bone loss. People don't think about bone loss, but it's like 1 out of every 2 women now will have a fracture. That's after 50. That's crazy. And I think with hip fractures in particular, it's like a 30% death rate within the first year after a hip fracture, I think, because of isolation, because of rehab, because of loss of independence. So these are not small things. It's not, we think about this, we're so myopic in our thinking of right now in menopause, but the broader implications of what that means for women to have a stroke, to have a heart attack, to deal with high blood pressure, to have, a fracture. This is massive. This is a huge impact on our quality of life over time. So they're big things.
And it's hard to think that we'll be there when you're in your 40s and 50s. You can't
Yeah.
imagine what you're going to be in your 60s and 70s because we're living ourselves right now. It's like when you were in your 20s, you couldn't imagine being 50. It's the same thing. And I think once you get there, then you go, all your friends are having these issues, and all your friends are dealing with the loss of bones and having heart attacks and all that. So then you go,
Yeah.
oh, this is what it is. But in our world, we're into prevention. We want to
Mhm.
prevent these things. And that's why we're talking so much about this, because yeah, we want people to take action, at least get some testing and see where your bones are, your heart and your brain and your vagina and all this stuff. Like, where are you at? And then you have a good baseline and you can do something about it. But
Yeah.
we often, yeah, just have our head in the sand until something breaks, and then we
I
go and
know.
try to fix it. Right.
I know. I know. And that's what we don't want to happen. We just want women to know now, because there's so much we can do to prevent these things. I mean, the lifestyle pieces too, of course, but to understand what hormones have been doing, it's just so powerful. You go, oh, okay, that makes sense.
Yeah. And so
Yeah.
actually, this is a great segue into my next question, because when we talk like this and we share our reels of the benefits of hormone therapy for women and going through this menopause transition. And then there are women out there who feel like they've missed the boat, or some that just feel sad, they feel guilty, they're bad about not taking hormones for whatever reasons. And I don't like these women to feel this way, and just feel like we should be offering two sides of the coin.
Yeah.
So, what would you say to these women who've, felt like they've missed the boat or are not on it?
It's interesting. I get a lot of messages from women that say that, like, I've discovered this whole set of things that were happening largely because of following maybe someone like you or me. And they're like, I had no idea. And then I actually went in and advocated for some testing of whatever it was. And they're like, I had no idea that these were the things that were happening. And they do feel like, what, I wish someone had told me, nobody had told me. And it's never too late. I think that's, at any point, any action that we take to try to prevent or protect our bodies from, further decline in any way, it's never too late. I mean, that's where I feel like even HRT, women will say, well, I was told I can't have it, I'm too old. We've talked about that before too, but there really is no window for HRT. There are some maybe more precautionary things we would do if it's been a super long time, and there's some reasons for that. But I think what we always tell women is the longer you're without these hormones, you do have this like longer window of time where your body is more vulnerable to these changes happening. So can we, if it's been 10 years, 15 years, is HRT going to reverse all of that? No, probably not. But it certainly can still help to support those tissues, those cells, those organs in your body. And coupled with lifestyle, really making like great lifestyle choices that support longevity and health and vitality. Those are really, really powerful things. So just small actions can be taken. HRT can be used really at any time. It's never too late. That's what I always tell them. Never. It really isn't. Dr. Rosensweet, we talk about it in grand rounds. We have people that are starting HRT in their 80s, they're in their 90s. I have a lot of people that come to me in my community, or just friends or messages or people that I'm talking to that say, my mom started it because of you, or because I've been following somebody. and she feels like her life is like flipped upside down in a good way. In her 70s, she's sleeping again. She's not using the bathroom 4 times a night. So these things are really powerful. And I think they can happen. They can help women at any age when we optimize hormones, our sex hormones, as well as all hormones in our body.
Mm. I'm so glad you mentioned that, and I think we just have to keep beating the drum too for this window of opportunity that these menopause societies put out there. But again, ultimately, that's the discussion you have with your doctor, and the doctor. It's we have these blanket statements like hormones are bad or dangerous or whatever. HRT does this or that or good or bad. But, HRT is such a broad term, right? It's not
Hmm.
just one thing. And like we mentioned before, there's so many different formulas and delivery methods and everyone responding differently. So we
Yes.
have so many options out there in
Hmm.
how to take this. And like you said, if you're approaching this at a later age, there are precautions to take. There are ways to do it. So I always talk about appropriate hormone therapy, right? Whatever that is to you, appropriate to you, because it's not just one size fits all. And I think that kind of breaks things down a little bit easier for people to understand and go, oh, okay, it's not just this blanket statement. We really need to do
Yeah.
that. And I always say that you can't out hormone a bad diet and lifestyle. So
Hmm.
whether you're on hormones or not on hormones, there's so many ways you can still protect your brains, your bones, your heart. Everything is you need to still do it. I'm sometimes afraid of the women who take HRT and be like, oh, don't need exercise anymore. Oh, don't have
Yes.
to worry about my bones anymore. No, in
Yeah.
my opinion, yeah, it's like a supplement. It's
I
there to
agree.
support, right?
Hmm.
It helps, it supercharges you, but it doesn't replace something, right? Your hormones are being replaced, but it doesn't replace the need to have good nutrition and manage your stress and get your sleep in and all the other things that we know are super important to us. And for those who choose not to, yes, do all of those things too. All right. You
Yes.
can still combat osteoporosis so many ways as well. So you just need to be aware and do what needs to be done.
Yeah. I love that you said that about, you can do both, and HRT is not the magic bullet. It's just, I think for a lot of women, it is that thing that when they're not sleeping, it's very hard to embrace lifestyle choices, like making good lifestyle choices. Or if if their mood is off, or if they're, having hot flashes all day. So I often find HRT, yes, the optimization piece is great, but also the way that it's helping women get to tackle those lifestyle pieces, because it's hard to even think about shopping healthy or cooking for yourself or getting to a gym or doing anything that involves supporting your health when you're not sleeping. I mean, we've all had sleepless nights. I know women, and I'm sure you do too, who have not slept for 20 years. Like, I haven't slept well in 20 years. Of course, they feel lousy. They feel like garbage. So I think for a lot of those women, optimizing the hormones, it's not the magic bullet, but it's a thing that gets them to, like, helps them so they get that good night's sleep. So now they can tackle the lifestyle. So that's where I see it being such a powerful, powerful, supportive piece of their health.
Exactly, exactly. So let's move on to the different formulations. I have to do a whole podcast on this because we could talk about it forever. We mentioned
Yeah.
several times, you've got patches and gels and orals and sprays and different ways to take estradiol or progesterone, testosterone, the bias, DHEA. So let's cover some of the more popular ones out there and tell us,
Mhm.
what do you see in your community that are most commonly used, and which ones are most successful with?
Yeah, it feels like, I think right now, because of all that we've learned about oral estrogen, we typically go to transdermal estrogen of some kind. Now, I will say a lot of the data that's out there about oral estrogen, a lot of those studies were done on synthetic oral estrogen like Premarin. So I don't know if there's some data on oral bioidentical estrogen not having the same impact, obviously, on, let's say, clotting factors as a synthetic estrogen. So I know some providers will use oral estrogen to help bring like LDL cholesterol down. That is not an area of expertise for me, but I tend to camp myself more in the transdermal estrogen because we know that it's very safe. We know that it's effective. We know that it's, for most women, really well absorbed in the body. I think anything that has to go through the liver first, I think midlife, we've been on the planet for a while. if we can avoid taxing our livers in any way, I feel like that's probably a better route to go. So I think even with some of the positive things that are out there about oral estrogen, even bioidentical, which I totally understand. Again, there's a buffet of options. So good thing we have options. But I think for most women, because we tend to have more, thicker blood, more clot promoting blood, it's just a different life now, that transdermal is just probably going to be the safest and most effective option for most women. But there's always exceptions, and some women may do better with something else. I would say in general, we see the patch. I see a lot of women using the patch, being very happy with that. I also see a lot of women that say they've had a reaction to the patch because of the adhesive, or they forget to change their patch. So they're better with some type of a daily topical. So I would probably say more women doing just some type of a transdermal estrogen cream, gel. I know that there's the spray. It's not as widely available, and I think it's a little more expensive. So I don't see that very often, but I'm seeing I'm seeing a lot more about it. So I'm wondering if that will kind of uptick a little bit. Um, I typically, that's where we're going to go with estrogen, vaginal estrogen too, especially if someone has those really that targeted need in the vagina, or for those genitourinary symptoms. You can use the systemic estrogen, so the transdermal, and use vaginal estrogen. You can just use vaginal estrogen if you need that for that tissue to help kind of revive it and get it back into, a better, healthier state. Some women use it continuously. It just depends. So I think there's some nice options with estrogen. With progesterone, we typically do oral for most women because it has that calming effect. It has that sleep effect at night. It's anti-anxiety. It just has so many benefits in the body in that way. There's some questions about whether topical, it's a big molecule. So I think a lot of the formulations topically, they're not getting absorbed into the skin. And so there's always the question, I think a lot of times progesterone's been used, or has been sort of touted as being important for the protection of the endometrial lining from growing out of control, which it is, but it does all these other things in the body too. But we do want to make sure that endometrium is protected. So, if someone's using transdermal estrogen, there is some, we know Dr. Rosensweet's oils, they're very high quality. So they seem to penetrate very well and get absorbed well through the skin. That doesn't seem to be the case with a lot of formulations topically. So I think it just depends. And I think most providers tend to lean on oral progesterone because we know it's going to get into the body, protect the endometrium, et cetera. You can use vaginal progesterone as well, and that's used as well. So again, this goes back to this buffet of options. There's so many great options out there. And then testosterone is really the third one in the sort of big series of hormones. And usually we're using transdermal testosterone for women. There is no FDA approved transdermal testosterone. So that would have to be compounded at a compounding pharmacy, but very effective, very safe, very important hormone for women, because we have, as you know, more testosterone than we do estrogen. So we don't want to leave that one off of the roster of possibilities when we're talking about HRT overall.
Yeah, I'm so glad you brought that in because a lot of women, actually, even the doctor, when I first was exploring hormones, I went to my traditional doctor in Spain here and I said, "Hey, tell me a little bit about testosterone, how I can get that." She looked at me and she says, "Women don't need testosterone."
Yeah.
After I picked up my jaw off the floor, I was left and I said, "Okay, I got to find somebody else." But the mentality here is still testosterone for men and not for women. And eventually, I was able to get a compounding pharmacy to make it, but it's certainly not something you go to the pharmacy and pick up and like they do because it's a men's dosage, which would be way too high for women. So
Yeah.
it's interesting. It is a huge menu of options, and again, I was just curious to see what's happening in your world, and it is the same as I've been hearing everywhere else. Is
Mhm.
usually the patches and the transdermals for most things. For the estrogen is good, testosterone, and it seems to work really well effectively with women, and then the oral progesterone too is just and near in Europe, or at least in Spain and Portugal, it's quite the same too. So they offer them both, but they tend to, so I see a lot more women using the oral progesterone, and because
Mhm.
they do seem to get, it's the benefits of sleep that are
Yeah.
just so magical. And so yeah, that's what I agree with. I'm There's one thing in Europe, I certainly have not yet in Spain and Portugal met anyone who's done biased. I don't think it's quite it's not a thing here, right?
Mhm.
But it'll probably come here anyways. But I have heard of some people offering pellets. So I want to
Mm.
know, what are your thoughts on pellets? Maybe explain what it is too.
Yeah, so pellets are it's the hormone essentially like is it's about the size, it's compounded into these it's almost like the size of like a grain of rice. They're just really tiny, like rabbit food, really small. And they're actually, I mean, technically they're surgically implanted in the butt and they deliver a dose of hormones over time. We typically see them with testosterone. There are estrogen pellets as well, but I would say by and large we see women with testosterone pellets. At least the women I'm seeing with testosterone pellets, and usually they're having those. Essentially, they'll last about 3 months, 4 months ish, and then they need to get new pellets inserted. I, I again, it's like anything. I'm not a fan of pellets, and the reason why I'm not a fan is because they seem to be the way that they seem to be used, at least in the United States, is they're really delivering super physiologic doses, just really high doses to women. And I think for a lot of women, initially, they're like, oh, I feel great. They've been sort of rock bottom for a while. And then they get these really high testosterone levels and they're going and they feel energized. And it's like amazing. They feel so good. But they're going back every, several months to get, new ones put in, and over time, what I've seen really is now they have this fallout of, okay, hair thing, a lot of those like androgenic symptoms where it's way too much testosterone, the hair thinning, the acne, the oily skin, even aggressiveness, moodiness. Some women even saying like their libido is off the charts, which may sound great sometimes, but like almost to an extreme the other way. And so I think it's hard to deliver. It seems, I think there are probably some providers that are very, very skilled at using pellets and can do them very well. It seems that a lot of the ways that they're done, it's like this weekend training for pellets somewhere with a company, and then you go out and you do them in your practice. And the mentorship, the sort of practice and experience, it's just, it's a powerful hormone. So I feel like it doesn't sit, most of what I see is sort of the negative side of it as opposed to the positive side of it. But I do know people, I know a handful of women who have been on pellets for years and actually love them and are not having those symptoms. But I think they're with providers who are like meticulous with their dosing, have really got this nailed down. So not my favorite, but it's more of an exception than a rule, I would say.
It's hard enough to find a menopause doctor who knows what they're doing with
Yes,
everything else.
yes.
To get someone trained in pellets is probably even harder to find. And I
Yeah.
find the same thing. And I notice, the way I understand it is that we're getting a very high dosage, and it's in the beginning we may feel excessive dosages, or
Mhm.
like you said, maybe it's great, it's perfect, it's high, but it's just what they want, and then as you go along it just sort of weans off. And so here you are stuck maybe a month feeling like crap. You cannot
Mm.
titrate. If you are getting the excessive dosage feelings, well, then you can't take them out. Like you can't,
No,
that's what I don't like. If somebody's using a
no.
gel or a cream or oil or spray, like we can cut the dosage in half. We can play around with it. And Dr. David Rosensweet did such a great job. He's teaching his patient, he's teaching his patients as well as the doctors to teach their patients how to self titrate.
Yeah.
And I don't recall in this program him even talking about pellets.
No.
Um, so yeah, so it's like, yeah, that's just completely left out, and I can see why. But pellets are just one of those things, and I think at least here, it seems as though it's just kind of done, and it's not necessarily done in a doctor's office or like a proper clinic. It's more of an anti-aging thing, and I don't know.
Mhm.
I'm a bit skeptical, but I just don't like the fact that you can't take them out if you don't like them. And then
Yes.
if you can't put them extra ones in when you start to wean off of them, and if it's lasting 4 weeks of feeling bad, like you just, I don't know. I'm not a fan either, and I don't know a whole lot of people and them using them, and the ones that I know are actually not really happy. And they so
Mhm.
and they're doing combination, including the testosterone, not testosterone. But yeah, anyways, glad we're on the same page with that, and
Yes.
I'm not going crazy.
Yeah, no, you're not going crazy. I also too, I had a really lengthy conversation with a pharmacist about that who's been in this space forever. And he was saying has seen a lot of patients with significant scar tissue, cellulitis. When you're surgically getting these things put in every few months, and you're talking about for years, what is going to happen to that tissue? You kind of run out of spots after a while. So,
Mhm.
just something else to think about. Who really wants to go in and have this done every several months? There's an easy solution, which is topical testosterone. It's just easy. It's you just rub it on your skin and you're done. So,
Yeah.
and you've got that steadier dosing where you're not having to deal with that giant peak and then that fall. So I love the idea of just that daily steady dosing versus something like this, which is just so much more cumbersome. So yeah, we're totally on the same page about that.
I hear injectables going well too. Like people want to, it's not everyone wants to inject themselves, but that I can see you can titrate and you can go a little bit less, a little bit more if you'd like.
Yeah.
And I think it's for those women who the creams are just not absorbing, not working. There's another way.
Yeah.
And I really believe in the testing too for
Mhm.
testosterone, particularly because you don't want to overdose and start losing your hair and have this deep voice and have all these other issues. Some of them, as I understand, are irreversible. So
Yes.
we got to test for that.
Mhm.
And so yeah, no, I think it's testosterone is a funny one. And then there's of course the women who do it all and it's still not working, and then perhaps it's not a hormonal thing. And
Yeah.
then maybe we go see a sex therapist or figure out other things in our
Mhm.
lives, and that's, when you've tried it all, you have to also think, well, maybe it isn't the hormones. It's not
Yes.
only about hormones sometimes, right?
Right. Exactly. Exactly.
Let's give women a few questions that they should come to their doctor's office with when they need help through menopause. What do you think they should be asking?
Yeah, I think to prepare for that visit for sure, I would tell women to track their symptoms. I think it's like the most magical thing you can do to actually present data to your doctor to say, this is what I'm experiencing, and really stand in your power that it's not all in your head. I think women are like, well, maybe it wasn't what I thought it was. When we have been tracking symptoms, it's right there in front of us, and we can show it to somebody else and say, this is what's happening. And because they have hopefully gotten some education under their belt, they're saying these are perimenopausal or menopausal symptoms. And so they feel really comfortable and confident advocating for what they need. I think, asking your doctor about sort of their philosophy, like their process, what types of hormones they're prescribing, is really important. I think their plan, like what is the plan? I think if you're seeing a provider who is uncomfortable with hormones, if you're having to sort of argue back and forth with your provider, you want a different provider because you want someone who's really comfortable, that shared decision making is in partnership with you. I hear a lot of women who are like, well, I asked, and they're like, well, I don't know. And they're going back and forth. And it's like, you want someone guiding you who knows a lot more than you do when it comes to hormones. So you want someone who really understands their stuff. I would say if someone is, asking them their process. So when will I be seeing you again? How will we titrate these hormones? Because I think what happens for a lot of women is if they're going to pursue hormone therapy, they get a prescription and they're like, we'll see you next year. There's no discussion about how to titrate. Let's circle back. I mean, I think the good providers, you're circling back within a month. Typically, it's going to be a month. I mean, you're going to see them in a month. You might see them another month later, or at least you've got this touch base back and forth so that as you're titrating. So I think understanding, kind of making sure that you're on the same page about, from what you've read and the formulations that are safe and effective. Are you guys sharing the same philosophies about hormones? Same thing about timing. Some providers, if you hear a provider saying, it's going to be a hard stop at 60, they're probably not someone who's in the know. A lot of providers are still in that old way of thinking, and that's really scary for women. So you want to find someone who understands the importance of optimizing hormones throughout your life, and that your body is, really used to these hormones. So I think it's just maybe not so much about even the specific questions, but making sure that they're really on the same page with you in terms of what you're looking for, is what they're able to help you with. So anything you can do even in advance to call their office and say, did they prescribe, even to kind of get a little behind the scenes, like what do they prescribe? Or do they work with compounding pharmacies? Because testosterone will have to be prescribed most likely from a compounding pharmacy. So you want to make sure that they understand all of the hormones are super important in the body and not just cherry picking one or the other, that this is somebody who really gets a menopausal woman and her body and her sort of future health as well.
I would also, I want to think about the woman. You and I are very so pro hormones. It's really hard. Sometimes I hold myself back from when I speak to women who don't know anything about it. And I just go, come on, I sound like the vegan who's trying to convert everybody. And I reel myself in and I'm like, okay, it's just my job is to empower her, have her learn how to
Mhm.
empower herself with information. And, and I'm wondering, just I'm having the thought of the woman who's listening now, who maybe doesn't want to do hormones.
Mhm.
And that's okay. I don't want anyone to feel bad or left out. And
Yeah.
for whatever reason she chooses, um, I guess the same would go for her if she has to find a doctor that resonates with her and her choices, right? It's, and like we said before, it's not only about hormones, it can do a whole
Yes.
lot. But I want to also advocate for the woman who's confused, maybe is not ready for hormone therapy yet, or just,
Mhm.
I don't know, doesn't want to go there for whatever reason. I want to respect her feelings as well.
Yeah.
So I would say probably this, the same thing. If you're looking for a doctor to, again, get in your mindset and get whatever it is that you want to be doing, you'll probably find that doctor somewhere. Just keep looking.
And don't you think I because I feel like even at IOBIM we talk about this, the whole idea is that we're presenting this providers providing options, saying here's what's happening in your body. Here's, we know that we're talking so much about hormones because we're saying hormonal changes are what are driving these things. But to say, hey, there are lifestyle things that can help. Nothing will replace the big shoes that your hormones have left behind, but you can do the other things. And maybe it's not right for you right now. So I think if you have a provider, to your point, who gets that this goes back to like the lifestyle and holistic things. We're looking at the body as a whole to say there are other things that you can do as well. Being realistic about the fact that nothing is going to ever be as powerful or as potent as a hormone. That's just the reality of hormones because they're so potent and powerful in our bodies. But I love that idea too. You may see someone for several years. That's why I think going back to preparing for this stage in life, if you can meet someone when you're 35 or 38 or 40 and start having the conversation, hey, I know this is coming. I'm not ready to do anything yet, but what are my options, or what should I start thinking about? You've got this sort of plan. And then if you feel like you're hanging by a thread or it's an SOS time or everything is heating up, you kind of already know what your options are. And you're like, I'm ready to kind of take this one, or this is enough for me. So I think the education piece is so big. And I don't think they're going to get a lot of that from a provider just because providers only have so much time. So it's almost like on the back end, if they can get this education, you walk in and you're like, okay, I just now need to find the provider that can help me execute my strategy as I go forward. I
Yeah.
know it's a lot for women to think about, but it's such an important thing.
It is. It is. You got to do
Yeah.
the work, even if
Yeah.
you're asymptomatic.
Yes. Yes.
You have to do the work. So,
Yeah.
we have just a few minutes left.
Yeah.
Let's talk about what are the what are your favorite solutions for hot flashes or anxiety, weight gain? Let's like stick with those things that are not hormonal. Like,
Yeah. I think with hot flashes, I do think we want to look at our life in general. I mean, if you're stressed out to the max and you're running like crazy, I mean, that is only going to make hot flashes worse. So, to say lifestyle is going to take care of it on its own, that probably is not going to happen. But I do think we want to take a step back and go, stress makes it worse. Blood sugar changes make it worse. Alcohol can make hot flashes worse. Caffeine can make it worse. So just making sort of some awareness so that women say when they're having hot flashes, maybe just look at what happened prior to. Is there something that maybe was a trigger for you? Because a lot of women will say, I know every time I have red wine, I have a hot flash. So there are things I think if you're kind of paying attention, you can sort of tease out the things that may be triggers for you. So at least you're even just thinking kind of on a daily basis, what might be a trigger for me, or stress. We talked about stress being one. Blood sugar stuff is just all about those metabolic changes. Blood sugar changes absolutely can make hot flashes worse as well. I think looking at foods, we can look at phytoestrogens like flax seeds and soy. Is it going to have the same impact as hormones? Probably not. But you know what? A little bit that, they are signaling those estrogen receptors as well. So it can sort of dissipate or quiet, maybe the hot flash isn't going to be quite as bad when you're thinking about, reducing your alcohol, maybe reducing caffeine, maybe bringing in some soy or phytoestrogens like soy and flax seeds, edamame, things like that. I would just say in general, I mean, obviously like, tempeh, miso, all that stuff. Exercise, huge for hot flashes. I mean, because again, this is the endothelial lining or blood vessels, vasodilation, they're expanding, they're contracting. Really thinking about the way like exercise and keeping a healthy body, a healthy cardiovascular system is going to be really huge. I think for hot flashes, there's studies that have shown that to be true. I think it's, I want to say like high intensity training helps with vascular endothelial growth factor, which can help with hot flashes. So, we do have lifestyle things that we can do. Getting sleep can be very helpful. It's kind of difficult when you're in the middle of a hot flash, but they kind of beget each other. So if you can sleep or at least do things surrounding good eating or sleeping hygiene, that's really helpful. Acupuncture has been very helpful for a lot of women. And I've heard that from patients. I've had that in my own experience. I've seen acupuncturist who treats women. So things like that, I think we can look at those lifestyle. There's some herbs and supplements that can be helpful as well. I think like black cohosh, maca. There's some that are more well studied than others. I'm trying to think sage. I don't know if there's any other on the list that are coming to mind. Valerian, maybe a little bit. There's been some studies. So, that's for hot flashes. Um, for like, do you have, I don't know if you wanted
Yeah,
to say anything there.
you said something that I, I, I was prepping for our podcast. Somebody was interviewing me, and I meant one of my recommendations in helping women to navigate through some of this confusion, among many other things, was to
Hmm.
also to use common sense.
Hmm.
So I don't know if you remember in 2023, last year, the Menopause Society, their position statement for hot flashes. Do you remember that?
Yes. Oh, yes, I do.
So, so, this is the
Mhm.
2023 evidence-based review of the
Yes.
literature. Okay. Evidence-based
Hmm.
review. Then it resulted in several non-hormone options for the treatment of vasomotor symptoms because they say, HRT is great for the hot flashes. But if not,
Yes.
what's recommended was cognitive behavioral therapy, okay, CBT, hypnosis, uh, SSRIs. These are antidepressants.
Hmm.
And what was not recommended was paced respiration, okay, breath work, let's call that,
Hmm.
supplements, herbs, cooling techniques, avoiding triggers, exercise, yoga, mindfulness-based interventions. I mean, sorry, these are and
Yes.
it's like a bold not recommended. And I'm like, why? Okay, if you take
Yeah.
this too seriously, it's of you've got to do this. And I know that there are plenty of women that I've met who have done all these quote unquote non-recommended things, and it has helped their hot flashes. It's it's again going back to common sense, because you can be like, oh, well, the Menopause Society said I don't do exercise. Well, forget that,
I
So
remember that so vividly. I wrote about that even in my last guide because I was so put off by that. Honestly, I thought they were saying like, we do not, I think they flat out said like, we do not recommend yoga or, it was a very blatant, like what, which didn't make any sense. Yeah. To the common sense piece, I 100% agree with you.
yeah, it's getting a little bit too sciencey, and yeah, just let's get realistic and in the real world and in the clinical practice. I mean, honestly. So yeah, I had to mention that because
Yes.
it is again, please, yeah, just use your brain, ladies. We can
Yes.
figure this all out. So
Yes. Yes.
so yeah. So is there anything else that you'd recommend?
I mean, for specifically for hot flushes, I think everything that you just recommended, especially the breath work, we were just talking about that before we went on camera, that breath work is so powerful. And I think we are always thinking like meditation, it has to be this big thing. It's really just stopping and spending 3 minutes, taking some deep breaths. it's this message. It's like you're sending your body this message to just calm down. So it's really just getting your place into this. We're typically like on fire all the time in terms of like what we're doing in our schedules and our responsibilities. So anything we can do to kind of, support our bodies during this time. We're going through some major changes. And so, yes, even those small lifestyle things like breathing can help at least mitigate hot flashes a little bit. You may need some heavier hitters, but those are at least some smaller things.
Mm.
I do want to comment like on weight gain, because that's such a big one, weight gain, body composition changes. I am hearing that so much with women, just like my weight, fat loss, fat loss, fat loss. And I really want women to shift away from I know we want to think about that, but what we really need to be thinking about is muscle gain. That is like the number one thing we can do for weight, body composition changes. It is going to happen to everyone to some extent, but the muscles, we have really neglected our muscles. We kind of think about, we forget that when we were younger, and if we had little kids, we're up and down, picking them up all day, lifting, we're strength training all day long as younger 20 somethings or 30 somethings. We don't expend as much energy now. We have to put muscle on. We have to make it a priority, as well as making sure we get adequate protein and carbohydrates. Carbohydrates are needed to build muscle. But I think we're so concerned about fat loss that what we really need to do is shift, because muscle gain is not only going to help with body composition and metabolic changes in our body, it's going to help with blood sugar. It's going to help with our bones. It's going to keep us upright and independent. So it's going to help with our balance. It's like it hits like every single possible, thing for our longevity. I feel like it's the most powerful thing that you can do is really start lifting weights, doing some type of, wherever you are. If it's 2-pound weight, start there. But wherever you are, start doing that and make that a priority.
Yeah, I love it. Do you know Celine Yeager from Hit Play Not Pause?
Yes.
I love
Yep.
that podcast. And
Yes.
she calls exercise the metabolic Spanx.
It is.
It is.
Yes.
It's a great, and I agree with you 100%. And I could go on as a gerontologist, and we're talking about longevity after menopause too. So it's
Yes.
not just about the transition, but many, many years after that. But I'm going to have to let you
Yeah.
go. I still
Yeah.
have several
Yes.
questions, but I'm going to have you on again, and I'm going to have you in our membership group. I'm super excited.
Yes.
We've got people already
Yes.
signing up for that. Your Q&A. So if anybody doesn't know about
Yes.
the menopause, the biohacking menopause program, you just jump in.
Yeah.
It's a membership program. We have loads of great people giving their opinions and advice in our private Q&A. So
Yes.
I think you're coming in April.
April. Yeah. It's in April.
Cool. Excited about that.
Yes.
And
Me
before
too.
we go, I want people to also know that they can go to your website, Jill Chmielewski or Chmielewski or
Yes.
Chmielewski. I'll have it all down there.
Yes. Perfect.
.com in the show
Yes.
notes and on
Hmm.
Instagram as well. You have the menopause timeline. It's a great little giveaway that you're giving us. And you
Hmm.
have also your own community, Pausing Together. Is there anything you want to share about your community or your events or anything else that you're offering?
Yeah, I mean, the community comes with the beginner's guide to HRT. So if people are interested in HRT, it's a great kind of first step to intro you into that. So you've got sort of, and it is, I talk about the physician visits and what that looks like and how to prepare and different types of HRT. Dr. Rosensweet is our community expert. So we do Q&As once a month. We've been doing them for almost 3 years now. So we've got 300 plus questions we've asked and answered that are all archived, tagged, cataloged. You can find them all. We have a lot of content in there aside from that, but it's a great place to connect and ask questions. It's very informal, but there is a lot of content just housed there. So if people are interested or just even want to pick up the guide, you can just join the community. It's just for a month and you can pop back out and you've got the guide. But yeah, that's what I'm working on some other things. Nothing to talk about yet, but I will keep you posted.
Great for the next
Yeah.
time. So
Yes.
I will have links to all of this in the show notes.
Okay.
And before I let you go, do you have any last words for a woman going through the menopause transition?
Gosh, we're gonna get through this together. I think just building your team, like getting educated and then starting to think about building your team of people that you need to support you is, it's going to be different for everyone, but the earlier the better. I think that's my advice. Like, don't wait until you're 50 to start looking into this. If you have, that's okay, start now. But if you're in your 30s, that's a great time to start looking at this because this is going to happen to you. It happens to everyone, and it's not a bad thing. It's just a transition we want to be prepared for. So we're not trying to scare women. We just feel like if women understand what's coming, I know you feel that way. I do too. You're so much more prepared and you're not panicking when the time comes when things start to change because you know all these changes are coming.
Yeah, nothing to be scared about. Thank you
No,
so much. All
thank
right, we'll see
you.
you next time. Thank you so
All
much. Have
all
a
right.
good
Thanks so
day.
much for having me. Okay.
Bye.